Good afternoon, everybody, or if you are dialing from outside UAE, good morning, good evening, or good day to you wherever you are. Thank you so much indeed for dialing in. It's a really great pleasure to be with you. My name is Dr. Saeed Rafi. I'm a consultant medical oncologist at Medical Clinic City Hospital here in Dubai. And as you all know, February is a month of cancer awareness. So our colleagues, they have organized this session to talk a little bit about the cancer and, the importance of being aware about it and the importance of the early diagnosis. So this is going to be a fairly short talk. We are not going to take too much of your time. It's probably around 15-20 minutes. And then we will have a little bit of a chance to have a discussion together around this topic. So, what is cancer? So, in your left-hand side of the screen, you see the kind of a cartoon about the normal tissue in our body, which consists of our underlying tissue, some of the dividing cells. These the dividing cells, they are essential to our body, and they will give us the renewal of the cells within the body. Imagine that we have the skin. The skin is kind of renewed on a routine basis. We have the oral mucosa, which is the lining of our mouth, the food tract to the stomach, bowel, and so on and so forth. And all these cells, they need to be renewed on a routine basis in order to keep us healthy. So the cell division, basically, it is essential part of our growth. It is not something abnormal. The problem becomes when these cells, which now you can see on the right-hand side of the screen, they start to divide out of order, and then they go out of the control, and they keep on growing without any control, and then when we call them cancer. So this is basically a process by which a normal cell in your body starts to grow rapidly without any control, and that is where we call it a cancerous cell. So basically, why is a cell overgrowth is a problem? It is a problem because non-functional cells which crowd in the body, they will cause problems for the rest of the cells. The normal tissue in the body no longer works in the right way, and you may have symptoms. For instance, if there is a growth inside the food pipe, they will block the food pipe and we cannot swallow. If it is a growth inside the windpipe, the air pipe, we cannot breathe properly. If it is inside the breast, for instance, then there will be a lump and so on and so forth. Also, when the cells start to grow out of order, they consume a lot of energy, which is needed for the rest of the body. So they keep on taking the energy for their growth, and the rest of the normal part of the body, they do not get enough energy. So the patient or the person gets tired. They start to have symptoms such as weight loss and so on and so forth. The other problem is that when the cancer cells start to grow out of order, they do not keep on staying in the same place. They start to go other places, and then we call it a metastatic disease, and they cause a problem in other part of the body. For instance, if they metastasize to the liver or become a spread to the liver or bone or lung or other places in the body, they cause problem in the secondary organ as well. So this is actually a problem with the cancer. So what type of cancer do we have? There are a lot of different types of cancer depending on where they are coming from. Each tissue in your body can potentially get cancerous, whether it is in the head and neck, in the respiratory system, in the food system, in the breast, in other part of the body. And because they are coming from different parts and they are having a different patterns of the growth. The treatments are different for any of these cancers as well. So how common is the cancer? I mean, this cartoon is actually, it is from the WHO, World Health Organization, and as you can see, it is fairly recent data in 2020. The cancers, they are, they have different incidence in different parts of the world. In dark blue, you can see, for instance, in North America and part of Europe, it is fairly a common problem. And 257 patients per 100,000 population, they are at some point they are involved by cancer. In some part of the world, it is less of a problem. For instance, in some part of Africa, in some part of the Middle East, it is not as common as the Western world, so it is less of a problem. But again, in the country that we are living here in the UAE, you can see that there is a kind of a dark spot here, although that it is small to be too much visible, but in this country is also a common disease. So this is a kind of the incidence of different types of cancer in the world, again from WHO in 2020. And as you can see, the most common cancer is the breast cancer, which involves around 2,260,000 patients a year around the world. So this is fairly significant number. 11% or nearly 12% of all cancers, they are breast cancer. That is followed by lung cancer, which was the most common cancer in the world until 2020. It was superseded by breast cancer in 2020. Now lung cancer is the second most common cancer, again having incidence, around 11.4% of all the cancer, with around 2.2 million people being involved each year by lung cancer. The third most common cancer is colorectal cancer. It is in the large bowel and also the rectum. And again, 1.9 million people, they are involved. And then you have other cancers such as prostate cancer. Again, it's a very common cancer, 1.4 million. Stomach cancer, around 1 million people. Then liver cancer, cervical cancer. Then there are other types of cancer. Like I say, cancer can come from any part of the body. So, all those other kind of cancers collectively consist of 46% of the cancers in the world, and nearly 8.8 million people are involved in there. So total number of the patients, nearly 20 million, 19.2 million people, they have cancer in 2020, which is really a very significant number. Again, these bars, they show the same thing that we just reviewed before: breast cancer, prostate, lung, colorectal cancer. These are being the most common ones. In the UAE, it's a relatively small country, as you know, nearly around 10 million population. We diagnose around 4,800 patients in each year, and this is the data from WHO from 2020. Unfortunately, around 1,900 of these patients, they die sadly because of advanced disease. When you look at the UAE proportion of cancers, it is more or less similar to the world data, and in a way that breast cancer is very common here, and it is the first type of, or the most common cancer that we diagnose here in the UAE. Lung cancer is luckily not very common here. We have around 150 patients a year, but colorectal cancer is very common. When you look at the male and female ratio between these cancer, obviously breast cancer is very, very common in ladies. Around 38.8% of the cancers in the UAE, they are breast cancer. When you look at the male population, colorectal cancer is more common, followed by prostate cancer and lung cancer. Perhaps we have more smokers in gentlemen than ladies. This is why we see more lung cancer in gentlemen compared with the female population. So what are the risk factors for lung cancer? There are some exposure risk factors. For instance, you know, radiation. These radiation, then they can come from anywhere, so from X-rays, from sun exposure. Any radiation can increase the risk of cancer. We know that even some people who have frequent long-haul flying, because there are more radiation as you go higher into the sky, there is more chance of exposure into ionizing radiation. Smoking, of course, you know, it is very well known to cause lung cancer and bladder cancer. Some sort of chemicals, such as arsenic, they are very well known to cause different type of cancer. Alcohol, it is very known association with certain type of cancer, such as liver cancer and pancreatic cancer. But there are many other chemicals, to be honest, and hormonal exposure that, you know, it increases the risk of the cancer. And it is really very difficult to just come with a short list to say that these are only chemicals that they cause lung, you know, any type of cancer. So these are kind of a short exposure term. But there are also some infections that can increase the risk of the cancer, such as hepatitis, hepatitis B and C. We know that increases the risk of liver cancer. HPV infection, it is very well known to increase the risk of cervical cancer, penile cancer in men. And we also know that it is causing some sort of the mouth cancer and throat cancer as well. Luckily, these days we have some vaccination for HPV, and it is available for ladies. And, you know, again, in the UAE, we have adopted that, and, you know, the girls at the teenage years, they can receive the HPV vaccination. It has been a great really achievement to reduce the chance of cervical cancer in girls. Again, human immunodeficiency virus, or HIV virus, is very well known to increase the risk of cancer, in particular some skin cancers and lymphoma and cervical cancer. Now, some people, they have higher risk of developing cancer even if they do not have exposure, because the cancer runs through their family. They get abnormal genes from their parents, and therefore they have higher likelihood of having cancer. Some sort of breast cancers and gynecological cancers, such as ovarian cancer, some colon cancers, you know, they run through the families, and they are carrying a gene that they put them at the higher likelihood of developing cancer. This is why it is important that if there is a high chance of cancer in the family, these individuals, they get tested, and if they carry an abnormal gene, they go to have a screening more often. So these are some of the hereditary type of the cancer that we discussed: breast, ovarian, colon, some kidney cancers, some skin cancer. Prostate cancer is common. Again, you know, if you have a history of prostate cancer in the family, you are more likely to develop prostate cancer, and pancreatic cancer, again, the same as well. So this brings us to the topic of why it is important to have the detection of the cancer as early as possible, because when we detect cancer early, there is more likelihood that we can cure these patients, and the chance of survival of the cancer is very high. Now, in this diagram, you can see that on the left-hand side, these are the stages of the cancer, starting from the stage 0, where the cancerous cells is in the original tissue and it has not gone anywhere else up to stage 4 when we have the spread of the cancer throughout the body. And you can see that the survival of the cancer, unfortunately, it significantly diminishes from around 95% in early stage cancer, such as stage 0 and stage 1, down to only 5% if we diagnose the patient at stage 4. So what it means is that if I have 10 patients in a stage 1 disease, only a very small number of these patients, they can die of this early type of cancer, whereas again, when we come unfortunately to a stage 4, sadly majority of these patients will die of advanced cancer. So there is no point actually to start screening if you already have the diagnosis of the cancer. So this diagram basically shows you from a healthy cell up until the advanced cancer. As we start to have symptoms when we actually start to have the invasive cancer. So if we just draw this line right in the middle, on the left side, it is the precancerous stage. On the right side, when the cancer is already diagnosed, you can see that there is no point actually to do the screening for somebody who has advanced cancer or somebody who has developed an invasive cancer. We must concentrate on the healthy individuals in order to detect patients with early signs of the cancer rather than leaving it late to develop with an advanced disease. Because, if we develop signs and symptoms, we are probably around stage 1, stage 2 disease, where the likelihood of the survival is getting smaller the more advanced that the disease is. So we got to concentrate on this group of patients who are healthy individuals and they do not have any signs or symptoms. So we got to do the screening really at this stage rather than leaving it at a later stage. So there are different screening methods for each different type of cancer where they are coming from. For instance, for the breast, there are mammogram and ultrasound scan. It is recommended where the different part of the world, they have different kind of criteria for doing the mammogram. In the UAE, we have brought down the age of the breast screening to 40 years, whereas in the Western countries is a little bit later, around 50 years. In this country, we see a lot of young patients with breast cancer. Therefore, we screen our patient at the early age of around 40. So especially if you are a 40-year-old or older lady, if you have a family history, you have to start your screening. So if you have a family history, please do not wait until later. Please come and see us or breast screening team to do an earlier screening. Please do not leave it late. If you do not have any family history, please start the screening at the age of 40. Do not wait to feel a lump or something in your breast. Again, any patients, as well as having a screening, they have to recognize their breast, especially ladies. They need to examine their breast to know what is normal, what is abnormal. Especially in ladies, we have change in the texture of the breast during the menstrual period. Sometimes the breast is more firm during the menstruation and it is less firm after that. So you got to examine your breast on a regular basis to get the texture of your breast during different times, so you know what is normal, what is abnormal. If you feel any lump or bump or any abnormalities that you are not sure about it, please come and see either an oncologist or a breast screening team so that they can investigate it thoroughly. The next cancer that we can screen is a cervical cancer. Again, pap smear is very important tools for us to diagnose the abnormal cells in the cervix. Again, our gynecological colleagues, they can advise on that. It's a fairly simple test, to be honest. It's a life-saving test. If we see any abnormalities or anything in the pap smear, we can keep an eye, closer eye before the cancer spreads and becomes more advanced. It is really important to diagnose cervical cancer at the early stage because we can offer curative treatment, whereas when it becomes advanced cervical cancer, unfortunately, the rate of the cure, as we discussed before, becomes less. Colon cancer. It is very important to know about colon cancer. It is actually very common in the UAE. It is also very common outside the UAE in every part of the world. So if you have any bowel symptoms, if you have constipation, diarrhea, any change in your bowel habit, if you have signs that your function of the bowel is not normal, if you have bloatedness, anything like this, please go and see a gastroenterologist. These days we have much easier techniques such as colonoscopy, sigmoidoscopy. It is just sending a camera down into the bowel and having a look. They do some checks on the blood, in the microscopic bloods in the feces to see if there is any possible bleeding inside. We have certain ways of detecting this colon cancer at the earliest stage, and the earlier that we diagnose colon cancer, the easier to treat these one and to basically offer the chance of the cure to this patient. In fact, you know, to be honest, I did a recent colonoscopy myself. It is very easy to do the colonoscopy these days, and please, if you are around the age of 50 or above, even if you do not have any symptoms, we ask you please to go and see a gastroenterologist for colonoscopy. It is fairly simple test, to be honest. For me, it no pain or anything involved. You know, you are sent home on the same day. There is no side effect or anything to it. It was a fairly simple procedure to be done in less than a couple of hours, and it gives you the peace of mind that there is nothing growing inside your bowel, and before it is late you can diagnose if there is anything inside there. Prostate cancer is another cancer. It is obviously it is solely in gentlemen. It is common after the age of 50 again. The more older people get, the more likelihood of developing prostate cancer. So this is one of those organs that you need to get checked on an annual basis, or frequently, especially if you are above the age of 50. It is a good idea to see a urologist. It's a simple blood test called PSA. You can do a digital examination and ultrasound scan, look at the size of the prostate gland, and if there is any abnormalities or anything inside, you can detect as soon as possible. Again, prostate cancer is a cancer that we can treat fairly easily if we detect it early. If it becomes very late stage, it will become more difficult really to treat this cancer. So it is actually important that you get it checked. Skin is the easiest organ in the body for us to check because we can see it, right? You can just look at yourself, you can look at your skin, and then look at what is normal, what is abnormal. If you can see any mole, any change in the color of the skin, any change in the shape of the moles that you have, if they have started to change shape, or the borders of those moles become irregular, or in any way if you feel feel that there is some abnormalities, it is best to get it checked, especially in this country. We have a lot of sun exposure. Some people, they are coming from less sun exposed countries, and you know, as we discussed, sun exposure and ultraviolet lights, these are the risk factors. So very, very important that you get to know your skin, and then you examine your skin properly, and if you are unsure about something, to go and see a dermatologist. So the takeaway from this short talk today, like I said, it was just again to raise the awareness, was that first, please pay attention to your body. If you know that there is any symptoms such as change in your bowel habits, whether it is diarrhea, whether it is constipation, in your bladder habit, if you go to pass urine more frequently, if the caliber of your urine is changing, if there is blood inside or anything like that, please do not take these things lightly. It is important to go and see a doctor for that. If you have a change in your voice, or you know, if you have any change in the way that you know you smell, anything in the upper respiratory tract area that worries you, it is important to go and see a physician. If there is a change in the skin, if you see any abnormal lump, if there's some unusual discharge or bleeding in some part of the body, if you see any change in the texture of your breast, whether it is skin thickening, or whether it is lump, or whether you see the nipple is changing, or you're having a little bit of abnormal discharge or anything, these could be signs of cancer. So it is important that you go and see somebody as early as possible. Again, please do not wait for long. If you see that you have a cough, or you know, hoarseness, a change in the voice, these are the you know, signs that you have to go and seek help as soon as possible. Please go for cancer screening. These are available almost in all hospitals here, and they are fairly simple procedures that they can give you this peace of mind. One good news is that although that it is not completely approved yet, in the next couple of years we will be having more advanced screening tests, such as some blood tests which may be able to detect the cancer with a simple blood test, instead of just having a scan or, you know, colonoscopies. So these are coming with the new technologies in the next few years, but for the time being, you know, our traditional screening methods, such as colonoscopy, such as you know, some blood tests, for instance, for PSA, breast examination, mammogram, and these kind of things. These are very, very tried and tested methods that we can detect cancer as early as possible. So it was a short talk. Thank you so much indeed for listening. I stop now, and if there is any question, it would be my pleasure to answer those questions. Thank you for attending, and thank you for paying attention. Thank you.
Doc, your presentation has gone. Hello.
Do you still need it? We finished the presentation.
Yeah, so if anyone have any questions, you can post. So Doc, I will read out the question. So just for the audience to know, we also have Miss Lama from a company named Abatuna, who is a caregiver for cancer patients. We will go through her journey. We will quickly pick the first 10 questions and we will go with her session.
Sure.
So, Doc, the first question is for hereditary cancer, like colon, for example. You had said the first degree relatives have double the risk due to the genes. if the first degree colon cancer is not due to gene mutation, CRAS, etc., then can we say that the risk for getting the cancer is same as the other individuals?
Yes, I think so. So if the person who has developed a colon cancer, they do not have any abnormal gene, the likelihood of other family members carrying that gene is low. Hereditary cancers, whether it is colon cancer or breast cancer or other types of cancer, they tend to present themselves at an earlier age. So for instance, if you have members of the family, they have been diagnosed at the early age around 40, below 50 years, there is more likelihood of hereditary cancer rather than, family members being diagnosed at the later age around like in 70s or 80s. If you are carrying an abnormal gene, the abnormal gene usually they do not present themselves with a late onset cancer. They should present themselves with some cancer at the early years. So to answer that question, yes, if they do not have any abnormal gene, that likelihood is probably low.
Thanks, Doc. So, Doc, the next question is, if someone has a family history of cancer, at what age should they start screening themselves?
There are different the different type of cancer. We have different kind of guidelines. To be honest, breast cancer, we ask the ladies if they are known that they are, for instance, if their mother or sister, they are carrying an abnormal gene, we ask them to start being aware about their breast at the, around the age of 20, 25. And perhaps start regular screening around the age of 30. Again, usually if they want to develop cancer, it will be around that age, around 30 plus. It is less likely that below the age of 30 they're going to develop cancer, although that is not uncommon, but from the practical perspective, probably around the age of 30 they should be doing their regular mammograms or regular breast checks. For patients who have BRCA mutations, for instance, in breast cancer, we tend to do other safer methods such as MRI compared with mammogram, because we do not want to give the exposure to any type of X-rays. In colon cancer, if you are known to have some abnormality genes such as AFP, which is the familial polyposis, or HNPCC, which is another type of the colon cancer. We ask the individuals again to start screening at early onset around the age of, again, 30 or so, simply because, the more earlier that we diagnose the polyps and remove the polyps, the less likelihood of these polyps become cancerous. Prostate cancer, again, around, if you have a very strong family history around the age of 40, 45, the recommendation is to start the screening.
So, Doc, the next question is, are these tests covered by the insurance? I would rather want to pick up that question. You can check on your table of benefits. That is a table which your company or your HR would have shared with you. Alternatively, you can check with us, we are your broker. We are more than happy to assist you on that query. Going on to next question, Doc. Can you please repeat yourself as to what age is listed for screening in UAE? Cervical cancer screening in UK is 30 plus, for instance. Colon cancer, especially males, if there is any more screening available all throughout UAE. We wish to know the age so that we can keep an eye on it and get yourself screened. So, Doc, it may be worth knowing for each type of screening, for example, mammograms or the PSA testing for cervical cancers, what would be the right age of screening ourselves? And if there is any other alternate type of screening, does it worth screening ourselves for BRCA1 and 2 or any other genome testing for cancer?
Okay, thank you. This is a very good question. As you know, in the United Arab Emirates, there is no national cancer screening. Department of Health. When I say national cancer screening, there is a cancer screening available in the UAE. Both DHA and Department of Health, they have screening programs. So let me, for instance, share with you my screen again so that I can show you. So hold on 1 second. I will try to share my screen. I don't know if you see my screen now, but for instance, this is the Department of Health cervical cancer screening program, and that is very recent in March 2022. If you go to Department of Health, you can see all these documents basically per each cancer, which tells you what are the requirements for the screening. So when I say that there is no national cancer screening, because, you know, for instance, in a country in the UK, you get a letter when you are turned around 50, you get a letter inviting you to go and have a breast cancer screening. In this country, if you are sitting and waiting for a letter, there will be no letter coming to you to invite you to go and have the screening. But you know, there are screenings. So if you go to any hospital, you can see that people, they can actually do the screening for you, whether it is government hospital or whether it is a private hospital. Now on the screen you can see that this is the screening. They say that you have to have a pap smear for women aged 30 and above, and the frequency of the repeat every 3 years between the age of 25 and 29 years old. They recommend that you have to do a pap smear, so one pap smear every 3 years for women between the age of 25 and 29. When you become 30 and between 30 and 65, every 5 years, and that is because the rate of cervical cancer is less in older ladies. So there is certainly a screening program for that. For the breast cancer, it is age 40. So you know, when you turn 40, you can go and get yourself screened. Again, a lot of hospitals, they do offer screening, but again, you will not get an active invitation to go and have the screening. You have to be aware of it, and you have to go and get yourself a screen.
Understood. Friday. Now, the next question is with regards to the risk or precautions. I'm sure your answer would be with regards to cancer. We do not have any specific precautions to keep, but if you have something, anyone who is within the age of 25 to 40, is there any risk of precautions which they should keep in mind other than screening themselves as early as possible?
Of course, you know, you want to, first of all, to make sure that you do not expose your body to the toxins that may be causing some abnormal cancer growth, and that includes to keep your weight under the control, reducing the junk food, the processed food, too much fries, and these days we have obviously very easy to order food coming to us, and majority of these foods we are not really sure at under what condition they have been prepared. The oil that they have been used, what kind of quality of the oil and these things. So as much as you can to just make sure that what you are putting into your body is a healthy diet, as healthy as possible. We say that it should be a balanced food and not too much carbohydrate, not too much fatty material, and lots of vegetables. So that is one. Try to reduce the use of the chemicals. That is very important. Healthy lifestyle, such as stop smoking, reduce alcohol or stop alcohol, exercise as much as you can, and basically that is as much as our exposure to the sun. If it is a really very severe sun outside, you have to just try to go into the shade and this kind of stuff, basically. So these are important things to remember.
Next question is, I feel lump symptoms or any other FH is involved, one must get themselves checked. I get that, but I wish to know the screening months. I think this is a question. There are multiple questions on what age should someone get screened. We have got that answered multiple times.
Breast
Doc,
cancer at the age of 40, cervical at the age of 25, and colon cancer at the age of 50.
And Doc, should the first time the test is negative, what is the frequency? Should they repeat the screening?
Breast annual basis. As I showed you here, for the cervical cancer, pap smear every 3 years if you are between the age of 25 and 30, and every 5 years if you are above the age of 30, and colon cancer every 3 years.
Doc, is there any screening available for skin cancer should there be no symptoms? And what is the line of management to screen if there are multiple moles in the body?
If you are a person that you have a lot of moles, some places they offer what we call it mole mapping. Mole mapping is basically when they generate a mapping of the mole in your body with the measurement. There are certain equipment which basically record the size of each mole, the shape of each mole, and then every year you can go and do the mole mapping, and the computer will do analysis and tell us whether it is normal or abnormal.
Doc, can you put some light on the pancreatic cancer? What are the kind of symptoms should someone look for?
Pancreatic cancer, they actually have very non-specific symptoms. Most of the time we diagnose pancreatic cancer incidentally. Sometimes patients, they present with some bloating, occasional abdominal pain, back pain, and some changes in their bowel habits. To be honest, unfortunately, it does not have very specific signs and symptoms, and this is why that majority of the pancreatic cancer, sadly, they are being diagnosed at a later stage. It's just simply because it is not an accessible place that you can examine properly, and you do not see it. So we have to do a scan to see the pancreatic cancer. So if you are concerned, if you have any family that basically they have had pancreatic cancer, my suggestion is that you go and see a gastroenterologist for ultrasound scan or CT scan.
Can you also put some light on throat cancer or thyroid cancer? What are the symptoms should someone look at?
Throat cancer, if you have any change in your voice, if you feel that the swallowing is a problem, if you have a cough and then you have some bloods or anything in that area, you got to go and see a ENT specialist to do some checks. They have some devices that they send down the throat and then have a look inside. For the thyroid cancer, again, you know, if you feel that there is any lump in the neck growing, if you have any symptoms of low or hyperactive thyroid, you know, such as profuse sweating, such as your heart rate going up, jitteriness, you know, change in your mood, alternate change in your mood, dryness of the skin, like I said, sweating a lot, diarrhea. You know, these are the signs, and you may want to go and see your doctor for the check. Actually, it is fairly easy to check the thyroid with a simple ultrasound scan, which is the jelly scan of your neck, and then we can see the thyroid.
Doc, last two questions which we will pick up. First would be, is there any vitamins or supplements which you think can prevent cancer?
And no, there is not a single one, to be honest, that prevents cancer. We know that there is association between low vitamin D and some of the cancers, such as breast cancer, some other cancers. So I think vitamin D, to be honest, it is essential. Some people, they ignore that fact. So especially, I think, you know, above the age of 50, it is very important to have vitamin D and calcium because of several reasons. One is the cancer, the other one, the bone health, and so on and so forth. So it is best to check your vitamin D if it is if you have not done it before. If your vitamin D level is low, it's good to have a supplement.
Doc, can you little explain on the lipomas? And lastly, is a hair fall a symptom of cancer?
So lipoma is actually a growth in the fat, and majority of the time is not cancerous. So it is just a bit of lumpy tissue in the fat. And if it is not bothering you, we shouldn't be doing anything. But if it is large or, you know, causing pain or something, the treatment is a easy surgical treatment. You just open the skin and then you remove the lump. What was the next question?
Doc, is hair fall a symptom of cancer?
What, sorry?
Is hair fall a symptom of cancer?
Oh, hair fall? No, not really. I haven't heard of that. You know, sometimes, you know, obviously, if you have advanced cancer that is causing malnutrition, obviously hair loss can be one of the symptoms, but no, just a hair fall in a normal individual, it is unlikely to be a symptom of cancer.
So possibly it is because the audience sometimes they would have seen a lot of cancer patients without hair. So it is, I want to tell
that is actually
basically
not because of the cancer itself. It is probably the effect of the chemotherapies that we give, unfortunately. So the chemotherapies are the one that are causing hair loss rather than the cancer itself.
So Doc, going on to the next speaker for us, we have Miss Lama. Lama, if you could come live. Yeah, Lama, many thanks to come for this session. I want to introduce Lama. She is a caregiver herself, and we wanted her to explain her journey. It would be beneficial for a lot of people who is going through this, because it is not just the patient who suffers, it is also the family members who go through this journey. So thank you so much, Lama, for coming on to this platform. It's over to you.
Thank you for the opportunity. Are you able to both see me and hear me?
Yes, Lama, we can see you, and yes, we can.
Okay, perfect. And can you see my screen now?
Yes.
Okay, perfect. Hi, everyone. Thank you so much for this valuable opportunity. I would like to just show you a couple of slides and then questions. And if you don't mind, if everyone can please put themselves on mute in the meantime.
Yes.
So the presentation is on raising awareness of childhood cancer and supporting families. it's unfortunate, but we don't talk about childhood cancer specifically as much as we should. And this is the reason why I have decided to create my social enterprise. So I'll take you through what Abtalana is about. Important facts and statistics, a glance of the important numbers that you should keep in mind, the importance of art and medicine and the communication tool that I've created, the Super Kids children's book, and how we can all together raise awareness, specifically parents and any person who is in contact with children, whether it's educators or anyone in the medical field. It's important to know the first initial signs and symptoms of pediatric cancer. So why did I decide to create Abtalana? 5 main reasons. First of all, parents going through cancer, parents whose children are going through cancer, unfortunately don't have formal support channels that they can go to. So if a child gets diagnosed today, the parents are at a loss who to contact for support, especially those who have gone through their similar journeys. So Abtalana is the very first platform which connects these families to create meaningful relationships, to be able to share experiences and really be there for one another, because obviously mental health is very much compromised when a child gets diagnosed with cancer. Second point is that children fighting cancer are rarely the subjects of books, children's books specifically, and even conversations. For example, schools tend to have a Pink Cancer Awareness Day for breast cancer, but not the same for childhood cancer. So I'm working very hard to be able to raise awareness so that the children themselves know about cancer and are able to support each other when a child is diagnosed with cancer in the classroom. The third point is that parents and teachers are not aware of the signs and symptoms, and obviously it's not clear cut. It's not very clear that these are the signs and symptoms that always explain cancer. But if parents had more awareness, they would, first of all, not ignore any signs and be able to go to the doctor and not trust the first opinion if they're not convinced with it, and trust their gut if they need second and third opinions. And finally, we don't have a directory of important contacts such as doctors, hospitals, experts, anything related to insurance companies, support entities that can support and offer services to those families. And hence why I want to be able to create a directory that will serve them. I always think about the families who are recently diagnosed with cancer. It's important for them to find the information as rapidly as possible and with credible information. So I'll just take you very quickly about the global statistics. Globally, a child is diagnosed with cancer every 80 seconds, and there are 400,000 children diagnosed with cancer every year. 44%, unfortunately, are never diagnosed when a child, when the doctor is not aware of the symptoms, or when a child is not aware of or the parent is not aware of how serious the child is, what the child is going through. Survival rates are around 80% in developing countries, although it can go down to, unfortunately, 30%, which is really steep in low and middle income countries. And hence why the WHO's goal is to at least reach 60% by 2030. What about the UAE? In the UAE, we have around 125. Another research paper that I saw recently said 165 children that are diagnosed with cancer each year. And as the speaker said before me, there are around 4,600 adults that are diagnosed as well in the UAE. There are around 8,000 children diagnosed in the Arab region, and the most common childhood cancers are leukemia, brain and CNS, connective and soft tissue, non-Hodgkin's lymphoma, and bone. My own son is diagnosed with leukemia, and he's the inspiration behind everything that I'm doing. My son got diagnosed at the age of 2 with leukemia, and it completely came out of nowhere. So when it comes to childhood cancer, there are obviously a lot of types, 12 major ones, 100 subtypes. We cannot do screenings unlike it is how it is with adults, and we cannot prevent childhood cancer. But we can start raising our children to know about how they can lead healthy lives, not smoke, eat well, make sure that they do their fitness regimen to be able to stay healthy as much as they can, manage stress. And those, we can raise our children to be able to think of these, and we can be role models to them from a young age. Childhood cancers are cured generally with chemotherapy, surgery, radiotherapy, bone marrow transplant, and immunotherapy. My own son got chemotherapy and immunotherapy in the UAE. Approximately 10% of all children with cancer have a predisposition, hence it's genetic. And unfortunately, in the majority of situations, we still don't have a known cause, what causes childhood cancer. These are really important pieces of information in terms of the symptoms. Obviously, it doesn't always mean that if you see these, it means it's gonna signify cancer, but it's just important that when a child is constantly being sick, or they're always, or all of a sudden feeling very tired, pale-skinned, they have infections that don't go away, or random fevers that are unexplained, easy bleeding or bruising, extreme fatigue or weakness, shortness of breath, and coughing. These are signs that should be a red flag for a parent and ensure that they take their child to see the doctor. Other symptoms include bone or joint pain, unexplained swelling. And I'll tell you a story, unfortunately, that I heard just yesterday. A child was going to nursery and she had a very big belly, and she took the parent took the daughter to the doctor, and simply the case was dismissed, only to find out later that this child had cancer, and unfortunately they had already reached stage 4. And that's why it's very important to be able to raise awareness that doctors should be aware that cancer unfortunately can occur in children. Sometimes it gets dismissed. In our case, for example, it took us 2 weeks to find out about our child having leukemia. In other children, unfortunately, it can take months. What are the objectives for Abtalna, for my social enterprise? One, it's connecting families, because it's very important that we are able to be there for one another. 2, raise awareness. Unfortunately, we don't talk about it enough. February 15 is actually Pediatric Cancer Awareness Day. So I invite you and your organizations to raise awareness on February 15, and September as well is Pediatric Cancer Awareness Month. So let's ensure that at least during those 2 points in the year, we can be able to spread awareness about childhood cancer. And in terms of services, it's really important that we are able to provide these families with services that are either free or low cost, and walk you through in a bit what those services include. And finally, as I mentioned before, we don't have right now any platform that's comprehensive, credible, that has information that families going through cancer can go through. So that's why I'm working on a platform that will be on a first level national, and then on a second level regional, to be able to support our Abtalna, our superheroes. And for those of you who don't know, Abtalna in Arabic means our superheroes. I have written a children's book, and this is a beautiful photo of my son with Malak Jundi, who has illustrated the entire book. So it's very rare for a children's book to be so profound, speaking about the story of children going through cancer. What is it that they have to endure? And it's obviously a very hopeful book that supports the child going through cancer, and those who have nothing to do with cancer. It raises awareness about what a child goes through. And the fact that it's illustrated by a 12-year-old is really unique, because it's through the perspective of children. And I'm a big believer that we can also make use of art to be able to send medical messages and raise awareness of social causes. This is a sneak peek of the cover of the book. It's called Super Kids, Our Journey Healing from Cancer. And it takes the readers on a journey across 10 different rooms to be able to learn about cancer. And it's also written in poetry style, and it's engaging with activities so that the child feels involved going through reading the book. So how can we all together raise awareness of childhood cancer? I invite you to go through the website, abtalna.com, www.abtalna.com. You will see the story about us. There's a section for families, and we already have 15 families signing up within just a few weeks of launching the website. Our partner section is also a great section for you to also keep in mind if you're able to provide any services. It could be simple, like providing a photo shoot for a child who has finished treatment to be able to celebrate their journey. Or I'm also partnering, for example, now with psychology centers so that we can offer free psychological support for the children and for the families themselves. and even leisure entertainment. There's so much that we can offer in terms of partnerships to be able to offer them to the families and as well raise awareness. I've also created a resources section for families so that they can learn about the journey of fighting pediatric cancer. You can also find out more information about the book that I have written, and also you can purchase it there. And if you have any suggestions at any point, more than happy to receive them and to hear from you. And I please ask you to follow us on our social media on Abtalana. This is our Instagram page, to be able to raise awareness together, and you can reshare our content so that all our communities are aware about pediatric cancer and how we can support our families. Finally, reach out to me and to your colleagues, and reach in within yourselves and your teams to look into how we can all together raise awareness. Thank you so much for your time. If you have any questions or suggestions, I'm more than happy to hear them. Thank you.
Thanks, Lama. So Lama, to start with, I would want to, so that people know what is that they should look. So can you brief about what was your journey? I know you went through two cancer incidents. So can you
Yes.
take us what happened? How did you find it? How it was diagnosed? What was
Yes.
your journey with the treatment? What is the outcome? If you can take us through it, it will be really helpful.
Definitely, I would love to. So I had to go through two different journeys fighting cancer and being a caregiver. First of all, the most recent journey is my child. So at the age of 2 years and 2 months, to be precise, my husband actually noticed that he had a limp. So we thought, oh, that's weird. Maybe he twisted his ankle or something. And then we observed it for a day or two to see how serious is it. And we noticed that it was still there, and there was a random fever. So we booked an appointment with our pediatrician immediately. She saw him. She thought maybe it's transit synovitis, an issue with his hips. And we were asked to go see an orthopedic. We did several CT scans of the hip to find out what was wrong with him. And we were asked to take him home and have him sit on the couch for 3 days straight. He wasn't allowed to walk. We did that. It was very hard, to be honest, to have a 2-year-old seated on a couch for 3 days straight, but we did manage. But then we realized he's not feeling any better. The fever is still there. He's still in pain. He actually got worse. And one day, just after the shower, I was getting him dressed, and I noticed that he couldn't lift his arm. That was another big red flag for us. It was clearly not an issue in the hip. A blood test showed that there were blasts, cancerous cells. And with leukemia, unfortunately, it's so 25% of all childhood cancers are leukemia. So it's the most common childhood cancer. But because it's not localized, it's all over the body. This meant that the treatment is quite lengthy. So his treatment is around 2.5 years. We will hopefully finish this August. It's very long because obviously it's not localized. They are not sure where the cancer cells can be hidden. We've done a lot of tests called MRDs, minimum residual disease tests, to find out if he's in remission or not. The very first month of chemotherapy, called induction, we did the MRD test and it was positive. It was 0.01% and it needed to be below that, which meant it was positive, and he was moved from standard risk to high risk. So we had to do immunotherapy, which was another very terrifying journey because on the one hand, blinatumomab, we know globally that the research shows that it decreases the risk of relapse. But then we also had a lot of issues during the very first week. He had every possible side effects, including a 30-minute seizure. So we decided to pause it, put it on hold, and then resume. And he did 2 full cycles of immunotherapy. So that's the story of my son. How is he doing now? He's thankfully much better. He started school in September. And if you look at him, you wouldn't even tell what he's going through. I think children who go through experiences like these become so mature and so understanding of their circumstances. And hopefully by August, we will finish his cancer treatment. Now, the other sad story that I wanted to share with you, only to be able to raise awareness and to be able to, it's a matter of perspective, to be able to show you how life can be lived in some ways. My first husband got diagnosed with cancer, and it was an absolute shock. He was someone incredibly healthy, and all of a sudden he had tremendous body pain, an issue with his back and his hips, and we weren't sure what it was. He was misdiagnosed at first as disc, and then to find out while we were living in Australia that he had Ewing's sarcoma stage 4. Ewing's sarcoma is actually also a type of childhood cancer. It's very frequent for boys more than girls, ages 10 to 20 mostly, and it's very rare for an adult to get it. By the time we had known it had metastasized already, it has spread to several areas. With Ewing's sarcoma, it's 70% cure rate if it hasn't metastasized, but when it does, it drops to 15 to 30%. And after being his caregiver for 14 months straight, unfortunately, I lost him, but I gained so much from having him in my life that he keeps me going, and his memories keep me going. So that's also another reason why I decided to create Abtalana, that in our Arab world, we tend to shy away from, and even different cultures, not just us Arabs, we tend to shy away from talking about cancer. Even globally, we sometimes say the C word instead of saying cancer. We say المرض الخبيث أو هذاك المرض instead of saying cancer. We need to state what cancer is. We need to say that also when it comes to childhood cancer, there's 80% prognosis, 80% are cured. So let's focus on that and flip the perspective that we should in fact talk about cancer, or else we're not going to be raising awareness. And there could be children out there that are going through symptoms and their parents are not aware. That's it from my end. Please let me know if you have any questions or suggestions. Thank you.
Thank you so much, Lama, for sharing your story. So the most important thing, what we understood from your journey is the early, like Dr. Said said, the early screening is most important. Whenever we see any symptom,
Not screening per se. We cannot screen children. We don't have, unfortunately, the tests to screen children like we have with adults. But at least if we are aware of the symptoms and signs, and us as parents, we have a very, very big role to play. If a child says, honestly, I'm too tired, Baba and Mama, I cannot go to school today, let's not just automatically assume it's laziness, for example. Maybe this child is going through changes in their body, but they're not sure what they are. I had yesterday an amazing event with Jalila Foundation, and I invite you all to check out the footage on my social media page. And a child, not a child, even an adolescent who was 17 years old, he came and he spoke about his journey fighting testicular cancer. And by the time it was diagnosed, it was stage 4. And he hadn't known that he had an issue with his testicles. He didn't come forward and tell his parents. And unfortunately, when they found out, it was too late. So if we go and talk to our family, to our children, and tell them, listen, if you find any changes in your bodies, if you notice anything, and we should be also more vigilant. If you notice any changes in your body, come forward and tell us. Bruising, for example, is a sign. So if a child is excessively bruised, we might think, oh, it's they might have hit themselves. But let's just not over stress and worry about the risk of childhood cancer and the probability of it. That's not my intention, obviously. But at least let's keep it in the back of our mind and then further investigate when our gut feeling is that there's something wrong with this child.
Understand. Thank you so much, Lama. We have completed our time schedule. I'm sure if anyone have any queries or they want to reach out to Lama directly, you can reach out through Abtalana. Thank you so much. Thanks, Dr. Said, for your session, for your awareness section. Thanks everyone for joining this session. Thank you.
Thank you.
Thank you. Thank you very much.